On palpating the abdominal aorta, the diameter of the aorta is measured at 3 cm. This indicates an abdominal aorta that is A. Narrow door constricted. B. Normal size. C. Significantly enlarged and at risk for rupture. D. Slightly enlarged. The answer is B. Normal size. A healthy and normal abdominal aorta will measure between 2.5 to 3 cm in diameter. An abdominal aorta over 3 cm and under 5 cm in diameter is considered to be enlarged, and surgery to prevent abdominal aortic aneurysm is generally performed on abdominal aortas that surpass 5 cm in diameter in females or 5.5 cm in diameter in males. A patient reports to urgent care for colicky pain in the upper right quadrant that they rate as a 7 out of 10. The night before they ate a fatty meal with 2 glasses of wine. Which of the following tests would help you assess for cholecystitis? A. McBurney's point. B. Soa's sign. C. Murphy's sign. D. Rovsing's sign. The answer is A. Murphy's sign. A positive Murphy's sign is an indication of cholecystitis, or gallbladder inflammation. Testing for Murphy's sign is performed during an abdominal exam by asking the patient to breathe out slowly while the fingers of the examiner are slid under the right costal margin and held in place with firm pressure. The patient is then asked to inhale, which forces the abdominal contents upward. Murphy's sign is considered positive if the patient winces or flinches when breathing in, due to pain when the inflamed gallbladder comes in contact with the examiner's fingertips. Rovsing's sign, Soa's sign, and McBurney's point are all tests for appendicitis. When testing for the strength of the left biceps brachii muscle, a patient is found to be able to move freely against gravity, but is unable to flex against very gentle resistance by the examiner. What grade of muscle strength should their bicep be assigned? A. 3 of 5. B. 2 of 5. C. 4 of 5. D. 1 of 5. The answer is A. 3 of 5. In this case, the patient is able to move their biceps brachii against gravity, but they are unable to move against gentle resistance by the examiner. This means the muscle strength should be graded at 3 of 5. The muscle strength grade is as follows: 0 of 5, no contraction 1 of 5, muscle contraction, but no movement 2 of 5, movement with gravity, but not against gravity 3 of 5, movement against gravity, but not against resistance 4 of 5, movement against mild resistance by the examiner 5 of 5, normal muscle strength. What is the reference range for normal potassium levels? A. 3.5 to 5.0 milliequivalents per liter. B. 3.5 to 4.8 milliequivalents per liter. C. 3.2 to 5.0 milliequivalents per liter. D. 3.2 to 4.8 milliequivalents per liter. The answer is A. 3.5 to 5.0 milliequivalents per liter. The range for normal potassium levels in blood is 3.5 to 5.0 milliequivalents per liter. Anything above that, hyperkalemia, or below that range, hypokalemia, is considered abnormal. What is the reference range for normal sodium levels? A. 138 to 148 milliequivalents per liter. B. 130 to 140 milliequivalents per liter. C. 135 to 145 milliequivalents per liter. D. 132 to 142 milliequivalents per liter. The answer is C. 135 to 145 milliequivalents per liter. Normal levels for sodium are between 135 to 145 milliequivalents per liter. Anything below 135 milliequivalents per liter, hyponatremia, or above 145 milliequivalents per liter, hypernatremia. This is considered abnormal and should be evaluated further.